Hello, dear colleagues. My name is Dmytro Chumachenko, and I'm glad to present you results of our research, data-driven simulation of Ukrainian refugee flows, impact on COVID-19 dynamics in the UK. The COVID-19 pandemic caused by the novel coronavirus SARS-CoV-2 has emerged as a paramount global health crisis of the 21st century. Originating in Wuhan, China in late 2019, the virus swiftly traversed international borders, leading to widespread morbidity and mortality. The pandemic's multi-phased implications extend beyond the immediate health repercussions, influencing socio-economic structures, global trade, educational system, and mental health paradigms. The rapid transmission of the virus underscored the interconnectedness of modern societies and highlight vulnerabilities in public health infrastructure worldwide. The United Kingdom has been significantly impacted by the COVID-19 pandemic, with the first confirmed cases reported in late January 2020. The rapid spread of the SARS-CoV-2 virus across the nation necessitated implementing stringent public health measures, including multiple lockdowns, social distancing guidelines, and travel restrictions. The UK's healthcare system, particularly the National Health Service, faced unprecedented challenges, which surges in hospital admission and intensive care unit occupancies. On 22nd of February 2022, Russia initiated a full-scale military invasion of Ukraine, marking a significant escalation in the ongoing war of Russia and Ukraine. This military offensive had profound humanitarian implications, particularly for the civilian population. A notable and profoundly concerning aspect of the invasion was substantial civilian casualties resulting from the direct confrontations and collateral damage. Furthermore, critical infrastructure, including hospitals and healthcare facilities, were either directly targeted or inadvertently damaged, severely crippling Ukraine's health system. The destruction of these medical establishments disrupted immediate medical care for the injured and impeded the provision of routine healthcare services to the general population. The compounded effect of civilian casualties and the healthcare infrastructure's debilitation underscores the invasion's profound and lasting impact on Ukraine's societal fabric and public health landscape. Russia's full-scale invasion of Ukraine on 24th of February 2022 has had profound implications on the country's management and dynamics of COVID-19 pandemic. Amid the backdrop of the war, Ukraine was grappling with the Omicron strain, and the war has critically hampered the identification, diagnosis, and registration of COVID-19 cases. Medical facilities in conflict zones have been decimated, and the scarcity of medical personnel has further strained the already beleaguered health system. So this paper aims to develop a deep learning model of COVID-19 dynamics to estimate the impact of the Russian war in Ukraine on COVID-19 spreading in the UK. This study introduces a methodological approach to evaluate the impact of Russia's full-scale invasion of Ukraine on the trajectory of epidemic process. Initially, a machine learning framework is constructed to anticipate the patterns of disease prevalence and associated facilities in the UK, and the prevalence in the facilities. So the validity of the model is then ascertained by guiding its retrospective forecasting accuracy for disease prevalence and fatalities in the UK starting from 25th of January 2022 to the day before Russia's full-scale invasion of Ukraine on 23rd of February 2022. And subsequently, projections for disease prevalence and fatalities are made from the onset of the Russian war in Ukraine escalation on 24th of February 2022 to 25th of March 2022. So the study then delves into analysis that determinants that shapes epidemic trajectory, considering the specific infectious disease, its propagation characteristics, and geographical region and focus. As a basic forecasting model, we have applied the profit model. This model, developed by Facebook's core data science team, serves as a contemporary tool tailored for the time series forecasting, adeptly addressing the complexities inherent in data sets like the COVID-19 dynamics. A silent feature of the profit model is its capacity to generate uncertainty intervals accompanying its forecasts. Such intervals delineate a probable range for actual values, offering invaluable insights for stakeholders, requiring a holistic understanding of potential future scenarios and their reliability. So the profit model presents a sophisticated and modular approach to time series forecasting. It establishes itself as an indispensable tool in predicting intricate dynamics such as those observed in the epidemiology of diseases like COVID-19. On the slide, you can see the hyperparameters of the developed model. So the profit model was executed using the Python software environment to validate and fine-tune its capability in forecasting the COVID-19 epidemic trajectory. We assess the precision of the model of intervals for 3, 7, 14, 21, and 30 days. We source data about COVID-19 cases and fatalities in the UK for validation purposes from the World Health Organization COVID-19 dashboard. The evaluation data set encompassed figures on infections and deaths due to COVID-19 in the UK, spanning from 25th of January 2022 to 23rd of February 2022, corresponding to the 30 days after the beginning of the Russia's full-scale military invasion of Ukraine. So figure on the slide shows results of forecasting of cumulative deaths of COVID-19 in the UK from 25th of January 2022 to 23rd of February 2022. And the table on the slide shows mean absolute percentage error of cumulative data forecasts for that period. So forecasts were calculated concerning the trajectory of COVID-19 epidemics in the UK, starting from 24th of February to 25th of March 2022, to evaluate the full-scale Russian invasion of Ukraine impact on COVID-19 dynamics. The time frame corresponds to the initial 30 days following the Russia's full-scale military invasion of Ukraine. Figure on the slide shows results of forecasting of the cumulative cases of COVID-19 in the UK from 24th of February to 25th of March, and table on the slide shows mean absolute percentage error for cumulative data for the same period. So this research embarked on a comprehensive journey spanning various domains to understand the intricate dynamics of COVID-19 epidemic process in the UK, especially in the context of geopolitical events such as Russia's military invasion of Ukraine. The backdrop of the study was set against a massive migration wave triggered by the Russian war, with the UK emerging as a significant refugee for displaced Ukrainians. This migration poses a potential epidemiological challenge given the ongoing global pandemic. So the study employed a profit model, a state-of-the-art forecasting tool tailored to predict the epidemic's dynamics in the UK to navigate this complex scenario. And the results from the model were enlightening. Despite the inherent risks associated with large-scale migration during a pandemic, the UK stringent COVID-19 preventive measures accompanying visa protocol, social distancing guidelines, mask mandate, and impressive vaccination coverage effectively mitigated potential outbreaks. So the epidemiological analysis collaborated by the modeling outcomes consequently indicates that the influx of Ukrainian refugees didn't determinately impact the UK COVID-19 epidemic. So in the broader discussion, this research underscores the resilience of well-prepared public health systems, even in the face of dual challenges, a global pandemic and a significant geopolitical crisis. The findings also highlight the paramount importance of robust modeling techniques, which offer predictive insights and guide evidence-based public health decisions. This research contributes significantly to the academic discourse on the interplay between geopolitical events and public health outcomes, and it stands as a testament to the importance of preparedness, robust modeling, and evidence-driven policies in navigating the multi-phase challenges of our times. Thank you for your attention, and thanks for the armed forces of Ukraine to make this research happen.